Welcome to Smart Start, expert tips for infant care with the Center for Perinatal Advocacy at Providence Hospital. My name is Gladys Marie DeSelle, and I'm the Senior Director of Maternal Infant Health. Today, I'll be talking about Providence experts to achieve baby-friendly status. Now, at Providence, we've always been friendly to babies, but now we're especially promoting the best way to feed your baby, the natural way, breastfeeding. We are pursuing this because research has found that breastfed babies have better outcomes and breastfed moms also gain benefits. So at Providence, we're really excited to do this because in our community, we've seen an increase in childhood obesity and various types of cancer. And there is some research that says if we feed our babies this natural way, which will also save you time and money and perhaps reduce the baby's tendency to not do well on a particular formula, it will be a win for you, a win for your baby, and a win for our community. We're excited at Providence to be one of the few hospitals that have already gotten this far in the goal of bringing this excellent way of feeding your baby to our patients. So some of the things you can expect that when you come to Providence are going to happen is we're going to allow your baby to stay in the room so the baby can let you know when it's time to eat. We're also going to allow your baby to get skin to skin with you immediately after birth unless there's a medical indication that prevents it, so that your baby gets to know you and gets to start breastfeeding immediately. We're not going to give you pacifiers because we have counselors here that can help you if your baby is fussy to achieve the unique needs that you and your baby have. We're also not going to give you formula unless it's really medically indicated or you really want it, because we know that initially formula feeding can increase gassiness and digestion problems in newborns. So at Providence, we're going to do everything we can to help you to decide to breastfeed. Now, you may have some questions about why breastfeeding may be better than formula feeding, or you may just want more information. We have breastfeeding classes, and we encourage you to call us at 202-269-7549 to register for one of our free classes to learn more about why Providence Hospital has chosen to become baby friendly. We thank you for choosing Providence, and we thank you for taking time to listen.
Bienvenida a Smart Start, a Centro Perinatal Advocacy del Hospital Providencia. Mi nombre es Soledad Cheple, enfermera educadora del Hospital Providencia. Les voy a dar algunos consejos para el cuidado de su niño. Le voy a hablar sobre lactancia materna. La lactancia materna es saludable para el bebé y para la madre. Tiene muchos beneficios para la madre y para el bebé. El calostro, que es llamado ahora el líquido de oro, tiene nutrientes, tiene anticuerpos que protegen al bebé contra gérmenes. Para el beneficio para el bebé, le disminuye la enfermedad de diabetes, obesidad, leucemia, infecciones respiratorias, asma y otras enfermedades. Pero para la madre también tiene beneficios que les disminuye enfermedades como cáncer de la mama, cáncer del ovario, depresión postparto. ¿Qué está haciendo el Hospital Providencia para ayudar a estas madres sobre lactancia materna? Actualmente estamos ofreciendo clases prenatales sobre lactancia materna. Estamos ayudando a las madres durante su estadía en el hospital y le estamos dando seguimiento a las madres con llamadas telefónicas y citas en el Hospital Providencia para que satisfactoriamente estas madres puedan continuar amamantando. La designación del hospital Baby Friendly nos va a ayudar a proteger, a promover y a darle soporte a la lactancia materna, a todas estas madres que necesitan, ¿verdad?, continuar amamantando. Gracias por tomar este tiempo en aprender algo sobre lactancia materna. Si necesita clases de lactancia materna o tour, puede llamar al número telefónico al 202-269-7549 y preguntar por la enfermera Soledad Shepley. La espero. Muchas gracias.
Welcome to Smart Start, expert tips for infant care with the Center for Perinatal Advocacy out of Providence Hospital. My name is Endine Guanyala. I am a registered nurse here on labor and delivery, and I am also a lactation consultant. Today I will be talking to you about skin to skin. What is skin to skin? Why should you practice skin to skin with your new baby, and what you should expect here at Providence? Skin to skin is basically the practice of taking a newborn baby and placing this baby in direct contact with its mother's bare chest. The babies are usually placed facing downwards. That means baby's tummy is touching mommy's tummy. The baby's head is turned to the side. And you could put on a diaper on the baby as well as a hat, but you definitely want to cover the baby with some warm blankets. Now, why should you do skin to skin? Skin to skin has been shown through research to be able to soothe babies much better when they come out. They come to the new world, it's full of lights and noises, and the most safe place for them is right up listening to mom's heartbeat, which they've been doing for many months while they've been in the tummy. Skin to skin is also believed to regulate a baby's body temperature. It's believed to regulate the baby's oxygen levels and the baby's respiratory rate, and it's also believed to regulate a baby's blood sugar. Now, even if a mom chooses not to breastfeed, you can see that skin to skin has many other benefits for the baby. What should you expect at Providence Hospital? You should expect your baby to be placed skin to skin with you in the first hour after delivery, especially if it's a vaginal delivery, and especially if the baby does not require any resuscitation efforts from any of the delivery team. If you have a C-section, then you should expect that your baby goes skin to skin with you as soon as you and the baby are considered stable. Do skin to skin uninterrupted for at least 1 hour. If you want to do skin to skin longer, go ahead and do skin to skin longer. Do it every day, especially while you're here. It gives the baby a much better chance at learning how to breastfeed. And then again, it does provide the healthiest outcomes for your baby. Look at all the things that a mother's body does to keep her baby's body working normally. Thank you for choosing to learn skin to skin with us today. And if you have any more questions about skin to skin, you can contact me at 202-269-7355. Or you could also take a breastfeeding class. You can contact 202-269-7549. Thank you very much.
Welcome to Smart Start, expert tips for infant care with the Center for Perinatal Advocacy at Providence Hospital. Hello, my name is Carol Edgar, and I'm the nurse manager at the Center for Life Practice and the OBGYN Specialty Services. And along with the OBGYN Associates located in DePaul 216, I would like to review several measures that will assist in Providence Hospital's journey to becoming designated a baby-friendly facility. In addition to having a breastfeeding policy, we are fortunate enough to have 3 specially trained lactation counselors: registered nurse Zelda Stewart, medical assistant Angelica Miranda, and nurse midwife Caitlin Gibbons. On or about 28 weeks, we're going to engage you in your choice for feeding your baby. In addition to receiving information on breastfeeding, we're going to also give you information regarding skin to skin and rooming in. We're going to give you a flyer as well as a benefits bulletin. We encourage you to read this information and to please bring back questions to your provider, whether it's the nurse, the medical assistant, the nurse midwife, or the physician. Some of the things to expect when you come into the hospital. We encourage you to breastfeed on demand. Babies are little people with their own personality. We don't like to put them on time clocks. When they're hungry, feed them. In the unfortunate circumstance if you are separated from your baby, please know that there are going to be nurses and staff members who are going to help you maintain your milk production. Please remember that at the Center for Life, we have counselors that will help you once you've delivered. Come back for your postpartum visit. If you're having any difficulties with feedings, know that Zelda, Angelica, or Caitlin will be there to help you. Thank you so much for allowing us to participate in this very special time during your life. And thank you for listening to this video.
Bienvenidos Marestar del Centro Perinatal de Advocacia del Hospital Providencia. Mi nombre es Angélica Miranda, soy la asistente de la doctora y a la vez consejera de lactancia en el Centro de Vida. Hoy vamos a hablar de unos mensajes que le va a ayudar al hospital a ganar la designación del Baby Friendly. Tenemos designado 3 personas encargadas en el Centro de Vida para ayudarle si tienes preguntas, y son la partera Kaylee Gibbons, la enfermera Selby Stewart y yo, Angélica Miranda. En la semana 28 vamos a dar información acerca de lo que es contacto piel a piel y el alojamiento conjunto. Le daremos un folleto acerca de esto. Si tiene preguntas, hable con la partera, con el doctor o con la asistente del doctor encargada. Hay muchas cosas que sucederán cuando venga al hospital. Nosotros promoveremos la lactancia materna, que es a libre demanda. Cuando el bebé tiene hambre, dele de lactar. Hay circunstancias en las que se pueda separar al bebé, pero habrá una enfermera que le ayudará a promover la producción de leche. En el Centro de Vida hay consejeros y queremos que venga después del parto para ayudar a resolver sus preguntas o alguna duda. Gracias por ayudar a escuchar esto y ser parte de esta experiencia especial.
Welcome to Smart Start, expert tips for infant care with the Center for Perinatal Advocacy at Providence Hospital. My name is Zelda Stewart. I'm a registered nurse at the Center for Life, the OBGYN clinic. I'm here to talk to you a little bit about the benefits of breastfeeding for mom and breastfeeding for baby. One of the first things we will discuss now is skin-to-skin contact. Skin-to-skin contact is when the mother, after the baby is born, baby is placed upon her chest. She gets this good contact. It helps stabilizes the baby's heart rate, helps stabilizes the baby with his blood sugar. This is very good. It can be done by either the mother, significant other that's in the room, any parent, grandparent that's there. Baby will get to know mom really well. The other thing that benefits that we're talking about is rooming in. Rooming in is when the baby is there with the mom, so the baby gets used to the mom and mom gets used to caring for the baby exclusively before going home. This is when she gets to know her baby, able to know her sound of her baby, like when the baby is getting hungry, she can go ahead and breastfeed it, because breastfeeding is on a demand schedule. There's not a schedule like the formula. This is demand. And always remember that breastfeeding and breast milk is free. The other thing benefits of breastfeeding from mom is that it will decrease the risk of uterine cancers, osteoporosis, and it helps the uterus to return to its natural state before pregnancy. Okay, other benefits for the babies, of course, is less upper respiratory infection, less ear infections, less childhood cancers, and of course, obesity, diabetes. This is the child that has less chance of dying from SIDS, which is sudden infant death syndrome. And we want to stress the importance of at least 6 months of breastfeeding. That's so beneficial to both mom and to baby. These babies have fewer diarrhea, fewer colicky instances. We also want to limit and not have pacifier feeding or taking of pacifiers with babies, because this baby needs to be nursing, not sucking on a pacifier, because therefore that baby is the one who will need to be breastfed perhaps a little bit more often. At any point in time, feel free to see myself. I'm at the OBGYN Center for Life, and there will be others who have been trained in childbirth education that can be of assistance to the mother prior to her leaving our hospital. Feel free to see us then. Thank you.
Bienvenidos Marestar del Centro Perinatal de Advocacy del Hospital Providencia. Mi nombre es Angélica Miranda, soy la asistente de la doctora y consejera de lactancia materna en el Centro de Vida. Hoy vamos a hablar de los beneficios de la lactancia materna y uno de ellos es el contacto piel a piel con su bebé, que le ayudará a mantener la temperatura y el latido del corazón del bebé se mantendrá estable. El bebé también se mantendrá seguro. También puede ayudar a los familiares como abuelos y tíos. Otra cosa también que quiero hablarles es el alojamiento conjunto del bebé. El bebé se quedará calmado y proporcionará seguridad en él. De esta manera usted conocerá al bebé cuando tiene hambre y podrá reconocer esto cuando llegue a casa. Otra cosa que quiero hablarle acerca son de los beneficios de la leche materna es que es free y barato, diferente de la fórmula. Entre otros beneficios son reduce el riesgo de cáncer al útero, osteoporosis, diabetes y la obesidad. Entre los beneficios del bebé son que menos riesgo de obesidad, menos riesgo de muerte súbita al nacer, menos riesgo de infecciones al oído y también infecciones respiratorias como el asma. Por lo menos debe de lactar los 6 primeros meses y debe ser exclusivo para poder ayudarlo a prevenir la mayoría de estas infecciones. No se ofrecerá chupetes durante la lactancia materna para poder evitar que haya confusión con los pezones, ya que la lactancia materna solamente será exclusivamente. Gracias por ayudarnos a escuchar y ser parte de esta experiencia especial.